When it comes to Medicare, experts say that Medicare Part D has helped to improve how affordable medications are for patients. But Americans enrolled in Part D are still seeing relatively high out-of-pocket costs. Congress wants to do something about that, and we're starting to see bipartisan support for placing a hard cap on out-of-pocket spending. Last week, Democratic Congresswoman Jan Schakowsky introduced the Medicare Prescription Drug Savings and Choice Act. The bill would establish a Medicare-administered Part D plan to give patients more choices. Congresswoman Schakowsky joins us now from Capitol Hill to discuss the state of Medicare and how it could be improved. She serves on the Democratic Steering and Policy Committee. She's also the chair of the Consumer Protection and Commerce Subcommittee. Welcome, Congresswoman. Thank you so much for joining us.
Thank you. It's a real pleasure to be with you. Thanks for inviting me.
Of course. So as part of this Medicare series, what we're really interested in is what could happen with Medicare Advantage and the growing bipartisan sentiment for actually expanding it.
Look, I am in favor. You mentioned lowering the cost of prescription drugs. Medicare is such an incredible program as it is, but we do need to do even more. 69 million people, people 65 and older, and people who have disabilities rely on Medicare. And I am proud that I helped with the writing of the Affordable Care Act that actually enhanced Medicare, made it easier for people to get preventive care, wellness exams every year for senior citizens and people with disabilities. But we also know that there are a lot of things that Medicare doesn't cover. In today's world, with not having no coverage for eyes, for ears, for hearing aids, that is, for dental, means that there's a lot of out-of-pocket costs still for seniors. And then there is the cost of prescription drugs, which are just out of sight. And I've been working very hard to lower those prescription drug costs, especially when you see those ads on television. Most of those are called biologics. They're the new drugs. They're kind of the miracle drugs that really are there for saving lives. But some of those drugs, one of them costs $250,000 for one person to take per year. Well, that's impossible for most people. So we have to do something about big pharma taking advantage of these consumers and charging so much.
Mm-hmm. Congressman, do you think that the new move to expand Medicare beyond people who are retirees, programs like Medicare for All, are helping or hurting the effort to address the program's current challenges?
So I'm on all of the bills that improve Medicare as it is, the traditional Medicare. I'm on Medicare for All. I'm for buying into Medicare. And Congresswoman Rosa DeLauro and I introduced a bill called Medicare for America, which would keep some of the features that are already there. It would allow big employers to continue their plans. It would allow Medicare Advantage to continue, because about 40% of seniors use those programs, those additional programs. But we changed some of the rules to make sure that it's affordable. Every single person under Medicare for America that's born would be immediately enrolled in Medicare for America. So it's a universal program. You know, whether or not or how fast we're going to be able to move toward those kinds of programs, I think they will happen one day, but I think we're more likely to see right now just improvements and addition to the more traditional Medicare program. And I'm so happy that the Democrats are in the majority, because the Republicans every year have introduced legislation that would turn Medicare into a voucher program that would set a limit on how much Medicare would cover, give seniors a voucher and say, good luck, go out and find the insurance that might cover you. So I'm adamantly against that and in favor of just enhancing traditional Medicare, which has been a lifesaver for decades now for older people and people with disabilities.
So, Congressman, one of the biggest challenges, you mentioned this at the beginning, is the price of drugs. What is going on that front? How might we see actual reforms in the future through this Congress?
Well, I think that is a top priority for us to lower the cost of prescription drugs. You know, the companies tell us the reason that their drug prices are so high is because of the cost of research and development. But we have no clue whether or not that's really true. So one of the bills I have is a transparency bill. They have to report their reasons for raising the price of drugs so high for the price that they choose. But in addition, we need Medicare to be able to negotiate for lower drug prices. And there's several bills, and I'm on all of them, that would actually allow for this kind of negotiation. Look, the Veterans Administration negotiates for lower prices for veterans with the pharmaceutical companies, and their prices are sometimes a fraction of what people on Medicare will pay. And so, you know, there's no reason for just allowing them whatever number they choose out of the sky to enhance their profits, to charge that. So I think that this is something where we can get bipartisan support. I have bipartisan support on a number of the bills that I've introduced.
So Congresswoman Larry Bishoni just joined us, said that the president's executive order on drug pricing transparency is a good step forward. Do you agree with that?
Well, you know, the president's plan, you know, I'm more than willing to work with him on that, but I really haven't seen something that is as substantive as we need, and I actually haven't seen him go forward quite too quickly. The one I really appreciated was that on television, they were going to have to put the price of the drug on the television ad. I think that'll really be helpful, and I'm hoping that next month, when it was scheduled to go into effect, that we're going to finally see that for drugs that are really expensive. So people know, and I think that there'll be a bit of a shaming aspect to it, where pharmaceutical companies will think, you know, by putting it's $10,000, it's $50,000, that there's going to be pressure to lower those prices.
Mm-hmm. Final question for you, ma'am. Last question, there's a talk about greater transparency of health data, including legislation aimed at forcing the release of Medicare claims data. Do you think that public release of the data is going to help a policymaker like yourself, providers and consumers?
I absolutely do. Right now, consumers cannot compare prices before they get the services at hospitals and different providers. You know, you don't want to go in blind, and I think having that kind of transparency is definitely a step forward and very helpful.
Well, thank you so much for joining us, Congresswoman. We really appreciate it.
It's my pleasure. Thank you.
We'll have more Rising for you after this.